Hi guys, this is Dr. Dave, Pacific Sound Plastic Surgery. I'm answering a question for everybody today of essentially what does gummy bear mean. So we're just finishing an operation in a patient that had ruptured implants. So this was 40-year-old implants from previous. We've known they're ruptured for over a year through an MRI. I got this question also in a consult today, so I thought I would just explain it. There are essentially two types of material you can have in an implant. Silicone, this is also silicone from the rupture, or saline. Now, obviously this isn't an implant, but that's what we inject into IVs, right? So what is the difference and why do we care? A lot of people say that silicone has a natural feel and is therefore the preferred implant. This is the majority, I would say greater than 80% of what we put in, probably 80 to 90% is silicone. Saline's a little cheaper. Saline sometimes can be made in a slightly larger implant. And if a saline implant ruptured, you know about it because it looks like this. Rupture, leakage, as you can imagine, that's eventually going to go away, and we're going to know about that, and that implant is going to be very obviously drained, and the breast will deflate. A silicone implant, on the other hand, and this is an older version of silicone, so that I would call this not gummy bear, this sort of gelatinous semi-solid substance is silicone, which is a polymer that's very soft, softer than rubber or plastic, but more cohesive than water, right? Or you have the next generation of silicone implants. So this is what people mean when they say gummy bear. There are various gummy bearness of these implants, if you will. Kind of cold gummy bear versus hot gummy bear is what I describe it as. But if you cut this implant, which I'll do for you right now, some of that material comes out, but it goes right back together. So gummy bear means form stable or cohesive, where if that implant is cut and there's even more cohesive versions than this, that's not going to go anywhere. If this implant ruptures, you actually need to detect it with advanced imaging, and there's recommendations for doing that at serial events after your implant. These last a long time. All implants in general last a long time and have a single digit per year known rupture rate, with silicones being slightly less than saline. So that is really what people mean when they say gummy bear implant. Form stable, comes back together.